The broadcast is now starting. All attendees are in listen-only mode.
Okay, hello everyone. We are going to start our review for fundamentals, and we will start talking about, let me see, the quality and safety QSEN safety education for nurses, and this is a new perspective about nursing education since 2005, and actually what is based on this is basically in three main beams of nursing education. That is the I call the ask, the attitude, the skills, and the knowledge. So mostly the QSEN what are talking about is about the patient central. The patient is the central of the care. How to work in team work and collaboration, safety, and informatics. So we will see that all these process need to be related to the patient central care. So that is what we are going to do. And QSEN, I will tell you, in all the process that we are going to go today, you need to just remember these three main beams of the QSEN. The skills, you develop your skills, your knowledge, and your attitude. So for these, they are going to be applied in any on all of the stages of the nursing process. All right, so let's start. All right, so we have the nursing process is a way of thinking and acting based on scientific methods. So what does it mean in few words? It's first of all your observation, collection of data. So what is that? Observation of what the patient is telling you, or listening to the patient and find a new, for example, new signs and symptoms, new lesions on the skin, or so something that the patient has referred to you. That is actually the observation that you're going to get on the patient, and then you're going to apply that. You're going to confirm that with the data that you're going to collect. So that is the beginning of the nursing process. So that is what we call the scientific method. So the observation, the collection of data that is going to support what you are observing. Okay, so we have a first of all, this nursing process is going to help us to have all what we already know. The nursing, first of all, the assessment, then the diagnosis, planning, implementation, and then the evaluation. So the assessment, because of the nursing assessment, a nursing diagnosis is established. So that is, you cannot jump from assessment to implementation at all. You need to go over all the process. You cannot jump from planning and evaluation. You need to do the implementation in between. So that is the steps that we need to follow in all this nursing process. Assessment. In assessment, you have the collection and collecting, organizing, documenting, and validating patient health data. So we are going to divide the assessment into main components, the primary source and the secondary source. Primary source is the patient. Secondary source is going to be others than the patient. So primary source, we have the subjective and the objective data. First of all, the subjective, you're going to make the patient verbalize and describe all what is his health condition. And objective, you will have, for example, your inspection, for example, of skin, or inspection of some devices that are connected to the patient, inspection of surgical wounds. You are going to collect vital signs and your laboratory test. So the patient should be briefly assessed always at the beginning of every shift, and more thoroughly if his or her condition changes as per the plan of care. Okay, the secondary source is going to be family. And when we are going to use family, when the patient, for example, is unconscious, or when you have some mental instability of the patient, or the children are very sick and they cannot communicate. Others secondary sources we have, for example, co-workers and medical records. Okay, so let's talk about a nursing diagnosis. And when we talk about a nursing diagnosis, is as definition is sorting and analyzing the assessment. So first is the assessment, then is the diagnosis, sorting and analyzing the assessment of data to identify potential health problems. So what means analyze? Analyze, analyze is to examine in detail. And what means to examine is to inspect in detail what is for to find the nature of the condition of the disease. For example, we are going to talk about heart failure. If the patient have heart failure, for example, you're going to have a decrease. If you find, for example, the decrease of the urinary output, if you have the increase of the heart rate, if you have orthopnea, or you have hypotension. So what could be your nursing diagnosis here? So based on the data that observation you have and the data you are going to document, you will see, for example, urinary output is related to what? Because the heart is not pumping properly, the perfusion of the kidneys are diminished and the filtration go down. So you have decrease of the urinary output. In order to compensate that, what is doing the heart? Trying to increase your heart rate. And that produce that is going to produce an increase of the frequency of the cardiac contraction. So now, one thing, when the blood is not pumping properly, the blood cannot pump to the whole body, and they cannot pump to the lungs. So the lungs will not have will not provide enough oxygenation to the body. So as a consequence, the patient start to have dyspnea, start to have orthopnea. So orthopnea means that the patient is supporting his hands in some hard structure, like the bed or the table, in order to breathe better. And they can lead to hypotension too. So what could be the nursing diagnosis? The nursing diagnosis in this case, based on your observation and your data that support that observation, is the diminish of the cardiac output. Diminish of the cardiac output. So that is your nursing diagnosis. Another example. For example, we have pneumonia. Pneumonia. So, how is going to be the nursing diagnosis? It's based on your observations and the data that you are going to document in order to support your your observations. For example, increase of the sputum production, increase of the sputum production, increase of the respiratory rate, increase, for example, we have problems with dyspnea. All right, so, and that is, if you put a stethoscope, probably you are going to, you put the stethoscope, you're going to find some adventitious sounds. So that all can reinforce a nursing diagnosis based on your observation, based on the collection of data, and measurable of the data that you have that support your observations. You can actually lead into diagnosis that is called ineffective airway clearance. Airway clearance. In addition, if the patient is having low oxygen saturation, in addition to that, you're going to be the dyspnea that can be shared in the ineffective airway clearance. But if you have, for example, impaired gas exchange, your low saturation oxygen will go down, and the dyspnea is going to be evident. So your nursing diagnosis in this case will be impaired gas exchange. Okay. All right. So let's keep going. So the planification. Talking about the planification, basically in few words, is just to identify priorities, your goals, right, and the planification. For example, we have planification to identify priorities. What are your priorities? We already know the high priorities, medium priorities, and low priorities. In this case, we talk about pneumonia again. So we have your ABC priority. So in conclusion, the physiological needs are priority number one. Number one. For that, you're going to start doing your goals, and for this, you're going to have SMART, the mnemonic, right? Specific, measurable, achievable, realistic, and in time. So that means, for example, in pneumonia, what are going to be the specific activities or specific what we call the implementation is assess the respiratory rate, the depth, the chest movement, auscultation of the lungs, right? So you need to if there is too much secretions, you are going to be using the suction machine. Measurable, for example, fluids. The patient need to be hydrated. So we are talking about pneumonia, for example. The patient need to be hydrated, and for that we need to provide about 3,000 mLs. Is indicated per day. And if the patient is dehydrated, the mucus get dry, and that is could be a source of infection, okay, or getting worse. So that is about the implementation. Let's talk about the next slide. That is about the evaluation. Evaluation is first of all, I recommend always, and I suggest you to read the chart first. The evaluation. Evaluation is going to what it's going to do is to check the effectiveness of the medication. So depends on the route, depends on the medication you're giving to the patient. That you are going to set a time where the monitoring of the medication is making effect. Okay, evaluation is the step in which the nurse determines whether the plan and interventions are effective or need to be modified. Okay. All right, so for evaluation, you need to do your physical exam, and the physical exam is related to a focal assessment, right? Focal assessment. You cannot actually it's not you cannot do head to toe all the time because it's taking few more minutes. So you need to direct. You always ask the patient if how he is feeling first, right? So probably you can actually find some new signs and symptoms. So that is part of the evaluation. All right, so critical thinking. What is critical thinking? Critical thinking is a very there is many books, many chapters. They can tell a lot of stuff, but they don't tell you straightforward what is critical thinking. I will try to make it very straight. Critical thinking basically is when you're asking, for example, why, where, when, how, who. So all those questions that is going to lead into critical thinking. So critical thinking is going to be based always in reliable observation. That's why it's a part of that part of the nursing process. Then we have these reliable observations that are based on your data that confirm or support your observations. That is going to take you into conclusions. All right, for example, I'm going to give you one example. If I have a patient, for example, they're going to go to surgery, and the patient is ordered to have 2 units of blood. 2 units of blood. So when they have 2 units of blood, you notice that after the first package, the patient oxygen saturation is going down. It's going to go from 97 to 92, 90, 89. So what you should do at this time? So we are using our critical thinking. Now, first of all, read the chart. When you read the chart, you will find out that the patient, for example, in this case, is having a heart failure. This heart failure means that the patient is probably the heart is not pumping properly. If the heart is not pumping properly, there is no sending blood to the lungs. So probably the patient is not oxygenating properly because it's overload of fluid, right? So what you should do in this case? So you have your observations, you have your clinical data that confirm what you are observing. And then most likely the patient is overloaded. So you need to do the S-bar, call the doctor and tell what is the situation of the patient's vital signs, symptoms, oxygen saturation, and the patient probably is going to have diuretics to decrease the volume in order to is overload. The heart is not able to handle the whole volume of blood. All right, so that is about another example. For example, a patient who has some amputation, and the patient is still having pain. The patient is receiving opioids, and the patient is telling you that the opioids are not working. So I want to have more dose because the pain is very, very intense. So you review and what you need to do. So you need to do your critical thinking. Okay, so go to the patient and you're going to do, first of all, your observation and your assessment. You're going to assess or reassess the patient, right? So reassessing the patient, you will find out that is an amputation of the, let's put lower or upper extremity, and the pain is still there. And you ask the patient to tell you how is the pain. And the pain mostly likely is characterized as neuropathic pain, right? So tingling, numbness, electrical, like electricity passing through the tissue, and the opioid obviously is not going is going to come. It's going to calm the pain, but not as effective as other medications. We have, for example, gabapentin that is used specifically for neuropathic pain. So you need to call the doctor, and the doctor is going to, you're going to tell the doctor, well, the pain looks like it's a neuropathic pain. The patient is referring that has this, and this type of pain. All right. So here I will suggest you to read the options here, the questions. That is these questions are just to reinforce the material that we already have. This is coming from the review that we have previous, or you have previous in your class. And for example, which of the following is an example of nursing statement that reflects using the scientific method of nursing process? All right, so I believe, so let's start. I believe that the patient is getting depressed, so it's very subjective. So there is nothing measurable here. The same with the patient doesn't look right to me. So it's your perspective, your point of view. So I think something is wrong. So doesn't give us any support. You don't have any data that support that observation or measurable data. The patient's husband told me that she's feeling very uncomfortable. Okay, another symptom that is actually not really a measurable data. The patient reports more pain than yesterday. So you have the pain is symptom, yes, but you are comparing from 24 hours before, and her blood pressure is elevated. So that is a nursing process. So you have a measurable data that blood pressure can be elevated, not because the patient is hypertensive, it's because the pain increase can actually increase the heart rate and increase the blood pressure. All right, so let's talk about all right, so this is that. So for the previous, we need to prioritize the problem, right? Compare with the baseline and how to prove that. So that is based on your observations and how you are going to support those observations with the clinical data. All right, so here we have the priority setting and organization work. So here we have placing nurse diagnosis interventions in order of importance. So we need to have the high priority, the medium priority, and the low priority. High priority will be the physiological needs. Another example here, choking and aspiration are life-threatening events and take priority over problems such as weakness, inability to speak, or weight loss. The upright position and reminders to tuck in the chin when swallowing is the most effective prevention for aspiration. So those are going to be, for example, your intervention. Priority setting includes addressing health endangering situations and physiological needs first. So, as a conclusion, physiological needs first. All right, so So what to do in some examples of data collection. When a patient refuses a treatment, the nurse should document the exact words of the patient regarding why the patient is refusing care. It's the best way to document and to not make judgment of what the patient is saying. So the best way is to just take note and put with the same words of the patient in the report. All right, so physical assessment, we have example. We are going to use the inspection. We are talking about assessment, in auscultation, palpation, and percussion, right? So basically, for LVM, we will do the inspection, auscultation, and some palpation. And it depends what area the technique is changing according to the area you are actually checking. So you're going to carry a head-to-toe examination. Mostly that is being done at the beginning of the admission of the patient. Then you're going to do focal assessment. Always try to think about that. It's likely that new signs and symptoms are going to happen, so you need to talk to the patient properly. Uh, all right, so for example, constipation. The examination to confirm and affirm that complaint of constipation is an assessment. So how you're going to do, how you're going to talk about constipation verbally first, right? Do you went to the bathroom? Are you passing gas? So then you are going to do your auscultation. If there's some bowel movements or there's some sounds of peristaltic movements on the abdomen, and then some palpation to check if there is some tenderness in some of these areas. All right. So please, yes, I would like you to go over some examples of questions. So Linda knows as part of her nursing assignment that she is to review and update the nursing care plan on her patients every 24 hours. Every 24 hours. The orders can change at least every 24 hours. A nursing diagnosis statement indicates that the patient's actual health status or the risk of the problem developing, the causative or related factors, and specific defining characteristics, signs, and symptoms. So nursing diagnosis is going to really, you need to master into to recognize and to check signs and symptoms. All right, so prioritization of problems, we have physiological, and then number two will be safety problems. All right, so we have the planification that is related to goals and outcomes. For example, we have a patient who has a stroke. The CVA is a cerebrovascular accident that is unable to independently change position or move the affected side. So the patient regained use of motor function loss. So it is important to prevent lost muscular strength, contractures, and pressure ulcers. So in here you have here we have a patient with a stroke, and number one is the mobility, right? Mobility is going to be poor, and the patient need to have passive movements, ROM, right? And range of movement. Passive range of movement. Why? Because the muscles, when they are not in activity, they are going to lose the elasticity, so they become stiff. So when you see a patient with contracture of muscle or stiffness of muscle, that means that the patient needs more activity, more passive movement from the nerves. And second, the patient is not moving. The patient is having, they can have some pressure ulcers that can actually lead into lesions on open wounds on the areas of pressure, especially in the sacral area, on the heels, etc. Example: patient is walking. Another example: patient is walking and is in higher risk of falling. So you see the patient that is walking, and the patient is ready to fall. So what you're going to do is just to take the patient and gently put it on the floor. So and that is a patient who is threatening a fall to be lowered to the floor to avoid injury from a fall by allowing the patient to gently slide down the nurse leg to the floor. All right, so that is, for example, some interventions that can happen in the moment. So you need to just be always alert on that. Documentation. When you are doing a documentation, don't try to give extra information. You go directly to the point. So they need to talk, for example, you're talking about pain, that is one of the most common. Uh, so you need to check the quality of the pain, the time of the pain, how at what time of the pain appears, or at what time the pain is getting worse, how much time is going to last the pain. So what aggravate or alleviate the pain. And for example, you have a periumbilical pain that is around the navel. It could be many things, from pancreatitis or obstruction or whatever. So periumbilical pain. So you need to check first of all the quality, 1 to 10. You need to ask the patient when the pain starts, after meals, during the night, during the day, any time. You ask the patient for how is the periodicity of the pain. Is it going to be every day? Is it going to last 1 hour, 2 hours, 3 hours? We need to look the location, of course, of the pain. A person reading a patient's chart. If a person is reading a patient's chart, that is a violation of confidentiality. Right, so that is something that you always need to be careful. The nurse recognizes the patients who demonstrate communication congruency. When the patient congruent communication is agreement of verbal and non-verbal messages. So the patient is is in griefness, or the patient is in pain, the patient is not going to be smiling, right? So they need to be a congruency on what the patient is telling you, and that is what is your observation about the patient verbal communication. All right, so here we have some examples of questions, so please go and review them. All right, so communication process. Communication process. As a rule, the primary care provider does not need to have the social security number or the hospital identification number. So don't give extra information to the doctor who is not needed. Um, And here we have some other slides that I will please like you to go over and review very careful. Cultural differences, communication skills, keeping focusing the patient is very important. You are going to the patient, and the patient is you're giving patient education, and the patient is telling you different stories not related to. So you need to refocus. How to refocus? Say, oh, it sounds very interesting, but we can have probably another time to talk more about that. So, but let's keep going with the training, and we finish, and we can tell at what time we can have more conversation about it. Okay, so a leader creates a vision that energizes others to follow, where areas a manager is assigned or appointed to the role and focus on the day-to-day required work. Okay, so a leader creates actually is proactive all the time. They are going to just encourage, give all the information to your person who you are that is in charge. You are in charge, and that is the difference between leadership and management. All right, so please, I will like you just to read all the examples I given to you here, and I think you are going to have a very good a view of what I was trying to show here about the nursing process. So, all right. So I think that's it for today. Thank you so much.